Well, so let's bring you up to speed with the latest news headlines we have. But let's just tell you that in our first story, authorities at the Surgical and Medical Emergency Unit of the Korle-bu Teaching Hospital are continuing to treat patients with critical ailments on plastic chairs and also on the floor after it became overwhelmed with the number of emergency cases. Though the hospital sent out notices to other health facilities not to make any referrals to the unit unless they were critical, it is yet to recover from, rather, the high numbers it took in before the moratorium. And the spike in the number of patients follows a Ministry of Health directive asking hospitals not to turn away patients, all because of lack of beds. Maxwell Agbagba visited the unit where he met Joshua Tete, whose mother died shortly after she got a bed to be treated at the facility.
Tears flow outside the surgical and emergency units of the Korle-bu Teaching Hospital. A woman has just lost her husband. Some meters away from where she's crying, an ambulance is waiting with a patient on a stretcher. The emergency unit of the hospital has been compelled to accommodate more people. After the directive, they should treat all emergency cases, even when there are no beds. I'm just stepping out of the surgical and medical emergency unit of the Korle-bu Teaching Hospital. Well, authorities here would not allow cameras inside this particular unit because of privacy issues. But inside there are some patients lying on the hard concrete floor receiving treatment. Now there are others also who are seated in plastic chairs receiving their intravenous fluid. That is the sad situation here at the Korle-bu Teaching Hospital. Yesterday, about 60 patients were inside this particular unit. It was constructed to accommodate just 36 patients, but now it has been overstretched to accommodate more. So, Chief, what's your name?
My name is Joshua Tete.
Okay, so tell me, when did you... I've met 29-year-old Joshua Tete outside the emergency unit. Her mother just passed away shortly after she was given a bed. Joshua says the deceased had been receiving treatment in a plastic chair for 2 days because there were no beds at the emergency unit.
I bring my mother on the hospital on the Saturday night, around 12 to 1. She fell unconscious. She fell unconscious. So we bring her to the Korle-bu Polyclinic. And when the doctor write a report for us to bring it to here, and then he took the report and read the report, and then he told us there is no bed here. So if my mother can spend an hour or an time on chair to sit for them to remove somebody, then replace her there, then we can stay. Then we say we don't have choice, so we have to do it like that. Then my mother spent 2 days on chair before she get a bed. She got a bed on Monday.
Okay, and then she died when?
She died yesterday, around 12.
Okay.
Yeah, because as the hours is spent on the chair, sometimes she used to come down. If I hold her, I pull her up, then she starts screaming. She complained of back pain. She spent 2 days on the chair. 2 days on the chair.
After the Korle-bu Teaching Hospital announced that it would only admit very critical cases at its surgical and emergency units, the number that report here at the Greater Accra Regional Hospital has shot up dramatically. I'm here to meet an emergency physician here at this facility, Dr. Yiman Olahiamble. I want to understand what mechanisms they have put in place to control the numbers that are likely to troop in here because of the situation at the Korle-bu Teaching Hospital.
Yes, yesterday we heard that Korle-bu is crowded and patients are seen outside the emergency departments. Eventually it's going to have ripple effects on the Greater Accra Regional Hospital because that is the foremost referral hospital in the country. It's a teaching hospital as well. For now, this morning, what we're doing is we are transferring patients to their respective wards, and we have been told that the wards are almost full, but the situation is under control for now. We have some openings in the emergency departments where we can receive more patients. Since we have been told not to send any patient away from the hospital, we put putting mechanism in place to receive all patients who are brought here later in the day or as time goes by, like creating extra trolleys, wheelchairs, chairs, etc. to accommodate them. So we have put mechanism in place to contain many patients for now.
Meanwhile, the Minister of Health, Kweku Agyemang-Manu, has directed the Korle-bu Teaching Hospital not to entertain patients with non-critical conditions. According to the minister, this is only the surest way to address the congestion currently being experienced at the facility. Speaking to JoyNews on the overcrowding situation there, the minister admonished patients and their families to consider seeking health care from other satellite facilities across the country, rather than using the Korle-bu Teaching Hospital as their first port of call.
When you go into an emergency, they check you and try to see how critical your condition is. So some are flagged red, some are flagged yellow, some are flagged green. If you are not in the red zone, they don't attend to you as an emergency. So you sit there and let them finish with the red ones first. So if you know you are not going to be in the red, right? Why do you go there and put a green there? Then you sit there for 3 hours. Then we have congestion in the A&E. So our conduct too is another problem. But we're going to do public education on some of these things, because it's not only resources that can take away some part of the burden. You see, strategy is another count. I mentioned about 7 satellite polyclinics that were supposed to take off some of the pressure from Korle-bu. But some of us are refusing even to go there. At the slight thing, we are in Korle-bu. So we are working on that. And I believe within the next 1 week or 2, we'll come up with certain things that will show to the Ghanaian population that we are working to try to bring down these type of challenges we have.
Well, let's move on. We'll bring you more on the current health situation being faced by the Korle-bu Teaching Hospital and the overcrowding being experienced in other hospitals across the country. But in fishing, some fishermen in Jamestown are vehemently kicking against government's decision to ban all fishing activities along Ghana's coast from August. And the situation, or the decision, is to help in reducing the excessive pressure and the over-exploitation of fish stock. Speaking to JoyNews, some fishermen said the decision will affect their livelihoods. JoyNews' Jacqueline Nate has been interacting with some of them.
I'm currently at Jamestown, a popular fishing community in Accra. Now, government has decided to place a 1-month ban on all fishing activities along the country's coast. Well, this decision by the government will help reduce the overexploitation of fish stock. Some fisher folks are of the view that if this ban comes in place, well, they will not be able to fend for their families because this is their source of livelihood. I'm here to speak with some fisher folks and find out from them what they make about this whole ban that will be in force in August. Ambana kade wopede wo ban more activities nina by August. Reaction, listen.
Oh, I'm blessed. I say abanu.
It is not lawful for government to impose a man's ban on fishing activities. The sea is God's creation. It cannot be compared to a fish pond where one has to replenish the stock. We don't have any form of education to qualify for a government job. This is all that we do to take care of our families. For all you know, the president has a relative who is a fisherman. So how does he expect us to fend for ourselves when the ban is in place? I will tell government to mind its own business whilst we do same, because I didn't go to school, and that is why I'm sending my children to school through what I earned from fishing. So if you say I should stop fishing, what else do I do? I cannot stop. Instead of banning, they should check light fishing and other forms of illegal fishing.
I do not understand the reason for this ban. This is what we do for a living. So if they say we should stop, it will trouble us a lot. Are they banning fishing so they give us another form of earning a livelihood? We don't even have enough catch. My highest catch is only enough to fill this container, and that is what I sell to take care of my wife and my family. If they prevent us from fishing, how do we fend for ourselves and our families? We are legal fishermen who apply the rules. So why do they want to ban us? We are not paid, and so we fend for ourselves. We do not catch the small fishes, so they should ban all those who fish illegally.
From my interactions with the fisher folks, one thing is clear, that they do not side with government's decision to ban all fishing activities along the country's coast come August. From Jamestown in Accra, I am Jacqueline Sylvia Nate.
And before we go, the roads minister has assured the people of the Volta region that the entire stretch of the Eastern Corridor Road would be completed by the end of the first term of the Akufo-Addo administration. The road network, which currently runs along the eastern border of the country, connects 5 of Ghana's 10 regions. Highlighting the importance of the routes, Kwesi Amakwata, who is a roads minister, said the entire 168-kilometer stretch is being repackaged to ensure speedy completion. He was speaking at Hokwe, where he addressed traditional rulers of the area.
The government of President Akufo-Addo is working very hard to work on the entire stretch to make sure that we make it motorable because of its importance. We have therefore packaged the areas that have never been done, and we have put those areas under a facility called Sino Hydro Facility. I want to assure you that advanced steps have been made and taken, and we are in close contact discussion with all the 7 contractors working on the Eastern Corridor Road. Togweo, Mamao, the people of Volta region, I want to assure you that from now onwards, you are going to see and witness for yourself a renewed effort that will be sustained to work on the Eastern Corridor.
And that's it for the latest news update we have. We have more news. We'll be having some great interactions. Kojo Yankson, Mamavio Swabwaje will be telling you what the latest update we have for the show this morning. But we'll be reviewing the newspapers. We'll be looking at the center spread back pages of the newspapers as well. We'll look at myjoyonline.com and the relevant other online portals. We're taking a break. When we come back, we'll have a lot more for you. It's still the AM show right here on the channel, Joy News.